Good morning, everybody. My past conflict of interest are published on the site of the EMA website. It's mostly acting as investigator or main investigator in clinical trials, mostly in the field of Alzheimer's disease and some consulting. Since I accepted the chairmanship of the SAG group, I have no conflict of interest. So my contribution would be to provide some feedback from the experience of a SAG, which is the Neurology SAG, mostly since the revised EMA policy was impacted on the functioning. Overall, I must say that this seems rather satisfactory. Very few SAG members discontinued their participation, mostly because they felt that this conflict of interest were too heavy for them. Also, and I will stay in the field with the ANIA contribution, it seems to be more difficult to invite leading experts. And still, it seems very important to be able to invite to the SAG this type of expert. We had in our group the direct experience of recent meetings where few experts were invited despite they had some direct or indirect conflict of interest. And it seems that this invitation was extremely fruitful because, of course, these experts are direct field experience with new and active drugs, for instance, and their participation to the open part of the meeting, but not to the final discussion, provided to the group extremely important feedback and insight. And it seems to us that this flexible attitude seems possible for the scientific advisory group. As you know, the scientific advisory groups have only a consultative mission. They are not decisional. Of course, safeguards are necessary. Some are already there. Conflict of interest and clearly mentioned at the meeting opening. Conclusion of the meeting are made only by the core members of the scientific advisory group and experts without any conflict of interest. And I think that verbatim of the meeting are available. My contribution, I want to make it a little bit practical. And mostly I would address the first question: what could the agency do to make more attractive for experts to participate? I'm a clinician. I think it's very important to everybody to acknowledge that being an expert is a real job. It's, for instance, reading and assessing extremely heavy reports, hundreds and sometimes 1,000 pages, often a very short notice, doing a personal search, personal reading, giving time, traveling, plus the meeting duration, already over the top, a very busy agenda. And in my experience, I'm very proud to say that in my group, all the members are taking very seriously their job. When an expert has to decide whether he will provide expertise to the EMA or national agency, he has still a balance between pros and cons. The pros and the cons are sometimes very difficult to balance. For instance, there's increasing obstacles to motivation. For instance, and mostly the relationship with the industry, direct financial link has to be renounced, boards, advising conferences, implication to clinical trials may be considered as a direct conflict of interest as soon as you're, for instance, principal or main investigator. And another very important topic I want to address is the sponsoring for meetings and congresses, which is also a very important issue. And so far, the expert is performing his job without any major compensation and very little recognition from institution. So far, for instance, for MEA, the expert have a small daily allowance and the full, of course, reimbursement for traveling. And from the national agency, there is nothing. So I would like to provide a few hints for the motivation. I think very important, and mostly for the motivation of very young colleagues who would be prone to participate as experts, to have a better recognition of implication in expertise in the professional career, for instance, in the academic career. I'm not really prone to think that a better financial compensation would be very important. Of course, everybody would be happy to receive more money, but I'm not sure it's the most important. But alternatively, I think that EMA and maybe national agency could sponsor participation of experts to meetings and congresses proportionally to their involvement, creating some kind of account with some possibility for the expert to get paid for the fees and the participation to congressings. And this would clearly avoid this type of link with industry. And it seems to me that it's very important for EMA or national agency to have well-informed experts participating with this participation to the congresses and to the meetings. So I think I'm done. Thank you so much.